navigation. And so we are going to start off in one moment. Okay, so I know we have a lot of background noise. So again, if you can mute, Ola's going to show us in one moment. But before we get into those housekeeping rules, I'm just going to introduce myself and my colleagues today. So Ola, if you can move us to the next slide, please. Okay, so hello everyone. My name is Megan Pizzacki. I'm a director on the communications team here at Health Leads. I am joined today by three of my Health Leads colleagues: Stacey Thomas, our director of the Contra Costa program in California; Daniel Chow, a program associate in the Bay Area; and Trace Wetterman, a director of program. And I'm really excited to have Stacey and Daniel with us today to help share some of their experiences and some of the adaptations they've made during the COVID crisis at the West County Health Center in California to make sure that patients are being connected to the resources they need. And so, like I mentioned before we dive in, my colleague Ola is going to review some of the helpful housekeeping information to make sure that you guys know how to mute and unmute yourself during the call so we can have a fun discussion.
Yeah. Can you guys just take a second to make sure you have the following panels open? You can see a participant panel that will let you see who is currently on the call. And then if you click the chat panel, you guys will be able to chat us as panelists and also to all the participants. And if you have any audio issues throughout this call, please click the audio connection information. And you can see the call number, the event number, and the
specifics I need to know from Joe. Like, I'm in the middle of two contracts. With businesses, is he going to continue to pay? Come on, guys. Continue to pay me as a consultant for those?
And I'm going to try to mute everyone right now.
You mean on the side, Maggie?
Okay. The chat function is on the bottom right-hand side of your screen. And if you're experiencing any technical issues or anything, just please be sure to private message the Learning Network, and I will help you with that. To raise your hand also for anything else, that's also on the bottom right-hand side of your screen. And if you're sending questions, please chat it to all participants, so make sure that two shows all participants. And if you want to come off of mute or mute yourself, click the speaker button that'll be to the right of your name. I want to let you guys know this webinar is being recorded, and we'll be sharing the recording and the slides afterwards.
All right, thank you so much, Ola. And for those who may not be familiar with Health Leads, sorry about that. There's some muting and unmuting going on behind the scenes. So like I was saying, if you're unfamiliar with Health Leads, we are an innovation hub that runs both national and local initiatives that address the deep societal roots of racial inequity that impact our health. And so as Black and Brown communities are disproportionately impacted by COVID because of structural racism, here at Health Leads, we're focused on both helping communities respond to immediate essential health resource needs and rebuild equitable systems for the future. So our Health Leads COVID work is really focused on 4 core areas. So the first is building a community-owned crisis-resilient tech infrastructure. The second is connecting people to essential resources using displaced workers who need an income. The third is creating community-owned data to identify gaps, enable local collaboration, and rebuild national and local systems. And finally, the fourth is sharing learnings and connecting folks so they can learn from one another, which is why we are all here today. And so we had reached out to our network and said, you know, what would be most useful to you during these upcoming weeks and months during the COVID-19 crisis? And so we received a lot of responses on what you thought would be most helpful. The top 3 that you can see here are, you know, how are others adjusting their social needs programs to account for the rise in individuals and families with essential needs, some strategies to support the most vulnerable populations, and some guidance on how to navigate current resource availability in your community. And so based on all of those responses, we've really kind of narrowed in on this network forum series that we're doing. And so we wanted to create an intentional space where you can support each other by sharing some of these promising practices, resources, learnings that will help you meaningfully and equitably adapt your social needs programs during this time. And so where we're really focusing in is the primary drivers of social needs integration. So like I mentioned before, during each of these forum series, each of the sessions are taking a deep dive into one of these primary drivers of social needs integration. And so today we are focused on resource navigation. And so in a time where we're seeing a huge increase in demand for essential resources and shelter-in-place orders, it's really becoming harder to connect patients to the resources they need right now. And so a lot of the questions we've been hearing are like, how have you had to adapt and shift your workflows to a virtual workforce when there's social distancing, canceled appointments, and then how are you making sure that those patients are still accessing the resources they need? And then with that in mind, how are you adapting to an ever-changing resource landscape when the demand is higher than the availability? And then the last piece we've been hearing a lot about is collaboration within your community. So how are you working with other organizations in the community to really come together and make best use of the resources available to help everyone out? And so with that, brings us to our learning objectives today. So really, we're really here to discuss how the resource navigation practices and strategies have been impacted by the COVID-19 crisis. And we want to create this space for dialogue that you can all share what's been working in your community and what hasn't. And that way you can engage with and learn from one another. So during this time, I really encourage you to please come up, raise your hand to come off of mute and share what's been happening in your community. Use the chat box. You can share any resources that have been helpful, ask any questions, and we'll have a really good discussion today. And so our discussion is going to be guided through a few generic poll questions that we're going to ask, and then we'll dive into each of those topics a little bit deeper. And so the one last thing I ask is when you do come off of mute, if you could please say your name and organization when you talk out loud, that would be really great. And so our first question is, where are you all calling in from today? And so we have a lovely map here. So if you look on the left of your screen, you see this little squiggle mark that calls an annotation. And so then you can click and show where you are from today. So for example, I am calling in from Boston. And so we see some people starting to click away. And also, please feel free, if the map isn't working, to just type in the chat box the state you're calling in from. So we see we've got some representation from the West Coast, down south, New England, the middle. I see in the chat box we've got Fresno, Brooklyn, New York, Pennsylvania, love it, Colorado, Oregon, we've got quite a few calling in from there, Arizona, New York City. So yeah, so as we can see on here, as you guys continue to fill out where you're calling in from, we are bringing in a bunch of different perspectives from across the country. And so we really hope that all of the practices and anything that you guys have been working through during this time, share with one another so you can all take those back to your clinics and communities and continue to make improvements and help each other out. And so thank you for doing all of that. So now we're going to go to our first poll question. And so what you're going to see on the bottom right hand of your screen is a poll is going to pop up. And Ola is just going to take a moment to launch that. Okay, so the question is, I have adapted my resource navigation workflows during COVID-19. Agree or disagree? And so you guys have about a minute to just take a quick moment to respond to that and let us know if you've had to adapt. I would imagine, based on a lot of what we've been hearing, a lot of you had to adapt. So curious to see how you all have had to adjust or not adjust your workflows. Excited to talk about that. So again, we have about 20 seconds left. If you haven't filled out the poll, it's on the right-hand side of the bottom of your screen. And so just hit agree or disagree and submit, and then we'll find out our results in a few seconds. All right, results should be coming in. So 88% have agreed that yes, you have had to adapt your resource navigation workflows. Like we hypothesized, this was something that we've been seeing a lot of. And so I would love for now to everyone to take the moment to, start chatting in some of those adaptations that you've made or some barriers that you've experienced. And we can start discussing this a little bit more. Some of the adaptations we've seen, Ola, if you want to go to the next slide. So some of the adaptations we've seen and heard, we've seen a lot of people, having to send out resource information packets in the mail, doing some virtual staff sign-in, sign-out forms to really make sure that keeping a running list of who was contacted, what was accomplished during each shift to make sure that patients were being taken well care of, and then some daily huddles with staff to make sure that everyone is up to date with the latest information on resource availability, and also just to make sure that staff are okay adapting to this virtual experience. And so, Daniel, I would love for you to tell us a bit about a project that you've been working on in the Bay Area about how, you really have been facing inequities head on by being proactive and reaching out to some of your high-risk patients. And so while Daniel tells a bit more about the project he's been working on and how they've had to adapt, I would really encourage you guys to chat in some of your adaptations or start raising your hand so we can bring you into the conversation.
Hi everyone, my name is Daniel, and I am one of the managers at our desk here in the Bay Area in San Pablo, California at West County Health Center. And, what we usually do, as you all may know, is connect essential resources to the population there. And some of the ways that we are adapting to send out this information is by reaching out to our former clients who we have worked with in the past here at HealthLeads, and seeing how they're holding up during this time, especially to folks who may be at high risk, such as seniors or families with young children. And that's been a really big part of our outreach during this time as well. In terms of our volunteers, the daily huddles with staff has been a really big proponent in building community within our volunteers still. Working virtually has been a big shift, as you all may know, and we try to maintain a sense of community by holding these huddles during shifts, checking in with one another to ensure that folks are feeling supported in the work that they're doing, because during these times it can be very difficult navigating all of the changes within resource information that's happening constantly. So those are a couple of ways that we are adapting to what's happening right now. And again, like Megan was saying, we would love to hear and chat from folks about what they've been doing to kind of remedy the changes as well.
Thanks so much, Daniel. That's really helpful. And I'm curious, when you shifted to that virtual workflow, was it easy for your staff to adapt to that and continue reaching out to the patients?
Yeah, that's a great question. We have software that we use on online already, and it was a fairly quick transition. So we were able to adjust accordingly. Again, there are a lot of aspects of our work that happen in person, direct face-to-face work with clients. And we have struggled a bit in that sense because, there is nothing better than face-to-face interaction, but we've been able to manage, as you mentioned earlier, one of the protocols that we've kind of adjusted for is sending in mail. We've been able to figure out a way to send in mail from home, which is really great, rather than sending it directly from West County Health Center. So our clients are still getting information through the mail, although it may be a bit delayed. If they don't have access to email or text messaging, those are services that we also provide. We are still trying to send out information through the mail because, as you all know, information is changing from day to day. So we're trying to do the best we can to keep updated.
Great. Yeah, those are all definitely some helpful tips. And so I see in the chat, Allison mentioned that targeting population towards those living alone and at risk for loneliness and social isolation. And Allison, it looks like you're willing to chat about this. So I'd love for you to come off mute and tell us what you've been doing.
Yeah, thank you. So I'm working with the Time Bank in New York. And for those who are not familiar, it's a special type of a volunteer program that works on the premise of exchanging services on a volunteer basis and then receiving services back. That's just kind of a loose description of it. But what we've done is we have looked at our membership and identified those who are living alone and or those who have been known to us to sometimes be facing loneliness or social isolation. And so we had an outbound telephone campaign to reach them, check in, see how they were doing, and also to identify if they had any needs and then provide resources to them. And I'm sure in other cities, the resource availability changes on a daily basis, if not daily, then hourly basis. So for us, the challenge was not so much making the outreach, it was keeping on top of what support services were available that we could refer people to. We also wound up doing in several occasions having to facilitate the acquiring of services. So in particular, meals are a huge issue. And there were problems with New York's ability to get food delivered to people. The city has set up a system where people who are not receiving home delivered meals could call into the city and request meals, but they had to do it every 2 days. And it was a nightmare. So staff were actually doing that for the members who were in need of food. So there was a lot of hands-on, not just in terms of outreach and giving referrals, but actually solving the problems directly for them.
Thanks so much for sharing that. Yeah, I mean, especially as we know, being able to outreach to people, especially in this time of stay at home where we're, all, socially isolating and that mental health aspect. So being able to reach out and talk to people and check in on one another is so important. And then, yeah, that, especially within New York, I can imagine a lot is tough right now, considering you guys are at the epicenter of the United States right now. And having to have your staff not just refer, but make sure that those solutions happen and at that frequency is definitely no easy feat. And so thank you for sharing that. And I'm wondering if there's anyone else who, after hearing Allison and Daniel, if there's anyone else who might have any questions or want to share any ways that they've adapted. Otherwise, if not, we can start moving on to our next question. All right, so in that case, we're going to move on to our next poll question, which we've definitely alluded to so far. Due to resource availability during COVID-19, it is difficult to refer patients to the following resources in my community. Check all that apply. And so again, the poll is on the bottom right hand of the WebEx screen. So just go in, check all that apply in your community, and then hit submit. And so, I mean, I know Daniel and Allison both alluded to this, and we've talked about this as well, about the resource landscape is changing, you know, day by day, sometimes hour by hour, and which doesn't make it easy to make sure that the patients are having the resources that they need and finding out what's open and what programs are still operational. And so we have about 20 seconds left. So if you haven't finished the poll, please make sure to do so, and then we can see what's happening in everyone's different communities. And while you see this question, like, definitely start chiming in if there's in the chat, if there's any areas that you've been seeing in your community that you haven't been able to refer patients to. Okay, so the poll is closing, and let's see. Okay, so a lot of people are seeing a decline in resource availability. So we're looking at, let's see, housing is definitely a big one. 70% of you have said there's been difficulty referring patients there. Housing, food, utilities, pretty much every category here has seen a decline in resource availability. And so I know, Daniel, that's something that you guys have also seen in the Bay Area. And I know you guys did like a scan, and I would love for you to kind of talk about how you guys discovered about around a third of housing resources that had to be temporarily closed or shut down, and how you guys have navigated that.
Yeah, so we were working on a project where we were calling to get updated information on tenant rights and eviction notices within the Bay Area. We were calling resources around 3 Bay Area counties: Contra Costa, San Francisco, and Alameda, again, to kind of double check resources, seeing if their hours had been adjusted or if they were closed. And what we did find was that about a third of the housing resources that had to do with tenant rights and evictions were temporarily closed for the time being. And there were also a good amount that had their hours adjusted, had some of their services reduced as well. For folks who are in the Bay Area, we are compiling that information into resource sheets. So if anyone is interested, please let us know. But, we have found that for housing, especially, we can see right here, it's really great. It's a really great need right now at 70%. And that information is changing every day. So that's one thing that we really want to make sure we're staying on top of, is ensuring that for a very high essential need like housing, information is being updated as much as possible. And I think that's something that we're going to try to be consistently calling in to check as well. I don't know about daily or hourly, even though information may be changing that frequently, but it's something we're going to try to stay on top of, definitely.
Yeah, that's great to hear that you guys are definitely trying to stay updated on that. And so I'm curious, to everyone on the line and to some of my fellow facilitators, what are you guys all doing when, how are you connecting patients to resources when you are finding that low availability? And especially with less resources available, how are you handling that overcapacity? And so what are you guys thinking? If, just thinking like within your communities, within your clinics, how have you seen reactions to that? And please, chat in any responses, any adaptations. Would love to know any solutions that you guys have for referring patients to resources when there is a low availability. Are you triaging and stratifying patients by, risk levels, by needs? Would love to know how you or your community partners are thinking through this. So if anyone would like to come off of mute or, chat in to the chat box, please do so we can have some good discussion and learn from each other.
Hello, this is Shannon. Can you hear me?
Yes, thank you. Hi, Shannon.
Hi, I'm from Rochester, New York, and so I just kind of wanted to piggyback off of the comments about housing. It is a huge issue here, too. I work with the Medicaid population, uninsured, high ED utilizers, So we have the resources in our area have done a really good job. I think specifically the food resources. We have Food Link here, which is a great organization. They created like drive-up places to get food and kind of restructured their work so that it's more in line with COVID-19 protections. As far as the housing, though, I think what we have been doing is more making sure that people have accurate information and that they're able to access their stimulus check if they were able to register for it. A lot of people that we work with don't file taxes. So providing them with that accurate information, there's a lot of misinformation within the community. So I try to tell my team that, we are the sources of fact and making sure that we know where to find that factual information.
Thank you so much for sharing that. And I love that your team is trying to be that source of truth. And so I'm wondering, where are you guys going to find that information and keep yourself updated to share back out to everyone?
So we go to the irs.gov, newyorkstate.gov for information specifically regarding the housing rights. When I've spoken to landlords and explained, the situation. So just like the official sites, and instead of, there's like a lot of I heard this, but making sure you know what the actual case is. Like there were people talking about how the Social Security office was open, but no, you can't go to the Social Security office, it's closed. So don't send people there. You need to call those organizations.
Yeah, that's so true. And so I'm curious, again, for either you or anyone else on the line, because that's definitely a real thing with a lot of government buildings being closed. And so how are you communicating that information out to patients? Are you doing a lot of outreach? Are patients reaching out directly to you and your organization?
I think it's both, but I don't know if anyone else wants to answer.
Yes, thank you, Shannon. I appreciate that. But yes, anyone else on the line, please, continue to chat in any thoughts you had on how you guys have been communicating these changes out, or, again, how you're, go ahead. Yes,
sorry, this is Shannon again. I just did want to add that a big barrier about these Social Security being closed is that there's a lot of bureaucracy to get into supportive housing or subsidized housing. So we've seen that as a big barrier, specifically like needing a Social Security card to complete the paperwork to get into the housing, not being able to get the Social Security card due to COVID-19 restrictions. So now this individual is stuck in the hospital. So a lot of little things like that have a huge impact on the life of patients.
Absolutely. It's really frustrating, especially when you think about that and how inequitable that is when, again, you have this process, but you can't fulfill the process because certain parts of that are closed or unavailable. And it's really hard, and that's a challenge that we've been hearing a lot of. And so I'm wondering if anyone else on the line, or, please, again, come off of mute or chat in the chat box about how you guys may be currently connecting your patients to resources, given the availability. And we'll give you guys another few minutes on this one, and then if not, we can start going through.
Megan, this is Stacy. And hi, everyone. This is Stacy from Northern California with HealthLeads. And one of the things that we've been looking at is how we can support our colleagues, the other workforces that we have been working with in Contra Costa. And we've been looking at triaging using our volunteer workforce, the advocates, and we have about 31 of them who have gone remote. And we want to look at how they can help the workforces who are actually in the clinic, seeing patients one-on-one and connecting them to resources. So we want to look at validating what resources are actually available and providing resources during this time for them. So we're looking at a system where they can reach the advocates directly and connect them to resources as they're seeing them in the clinic and connect them to those resources that are actually available right now. So that's something that we are looking to put in place next week, along with working with the 211 Contra Costa Crisis Center. And they currently have one person that's validating resources, again, looking to see what resources are actually open and available for different needs for folks right now. And the advocates, again, will be assigned to assist with validating resources, which will be uploaded into the database and available for different counties so that folks will know what's available and out there for them right now. And that's a way that we are partnering with folks and collaborating in the community.
Thanks so much for sharing that. And I love that, piloting and trying that out next week. I think that, having that opportunity, it's almost like being able to have that, face-to-face interaction. And I love that you'll be able to work with the clinic staff and make sure that that warm handover can still happen, even though the advocates can't be in person. And so, yeah, I'd love to hear that, and especially love that collaboration example. And we're definitely going to get into collaboration in a little bit more. But I want to say that in the chat, I see Tracy. Oh, is someone trying to come off of mute? Or, okay, just a bit of background noise. So anyway, so in the chat, Tracy has said that United Way of Greater Nashville's COVID-19 resources has been very useful. They set up a response fund, which allows businesses to receive funding to help the communities we serve. And then NWCHC receives funds to help pay for prescription meds. Tracy, if you are willing, I would love for you to be able to just, if you could expand upon that and come off of mute if you're available to. I would love to hear a bit more about that response fund. Okay. All right. Tracy, if you can come off, I would love to hear from you. If you can't, that is certainly okay. So if anyone has any other, comments on this, if not, we can certainly move on to our next question, which is about the collaboration aspect that's happening right now. So our next question for you all is, during COVID-19, I'm finding more opportunities to collaborate with other organizations in my community. And so again, the chat box is in the lower right-hand corner. And this is just an agree and disagree question. And I know Stacy gave us a great example of how they are collaborating with 211 right now to really validate those resources and make sure that they're up to date so that everyone in the community can have the right information at the right time. And so again, we've got about 30 seconds left. So finish taking the poll question, and would love to dive into this one a lot deeper, because this is something that we've been hearing a lot about. Is people have been noticing that there is definitely more opportunities to collaborate. And so we're going to definitely get into those details about how people are collaborating in ways that everyone can communicate with each other to really make sure everyone's up to date on, especially with the resource availability in your community. Okay, our poll is ending. Let's see what our response is. 69% agree that you are finding more opportunities to collaborate with one another. And so something like, as I said before, we have definitely been hearing this a lot too. And so, Ola, if you go to the next slide, we can hear some of the things we've been hearing. And so collaboration and communication are really key right now. We at HealthLeads, and I'm sure all of you agree, have known this for a very long time, that collaboration is super important, but especially right now, we really need good collaboration and communication with each other. And so something that we've been hearing a lot of organizations doing is having weekly meetings with stakeholders to determine resource availability within the community and helping that, influence, where they're going to send different patients to different community partners and trying to share out resources amongst each other. There's also been some shared running spreadsheets that community orgs update every day so that people can have as up-to-date information on what the status is on each of the different community orgs, and how, even what Stacey alluded to of calling community partners to provide support, including volunteering and, you know, thinking of how we're adjusting some of those workflows of if you're not able to right now, or if you're not seeing as many patients, how can you help some of your community organizations? And so volunteering, especially to help validate some resources so everyone's up to date when everything's changing so quickly. So again, I would love to invite anyone on the line to come off and hear how they've been seeing collaboration in their community increase or any best practices around that. So again, you can raise your hand, come off as mute, or chat in the chat box some examples of best practices. And so I don't know, Stacey or Daniel, have you been, I know you guys have been doing a lot with collaboration. Do you have any other examples where this has been going really well?
This is Stacey again. I have one other example regarding 211. I know they were looking for more volunteers to answer phones to kind of help folks. And so we've had a couple of our advocates who were trained as volunteers to answer phones and to give information about COVID specifically, because they were inundated with calls about COVID. And so they were giving specific training to some folks from different organizations to assist them with the calls from the community. And we had 2 advocates who were trained to provide calls and give information and assist them in that way.
Great, thank you for sharing that. That's really helpful. And I see Cynthia disagreed with the poll, and so I would love for her to come on the line right now and share that. So Cynthia,
sure.
You should be
unmuted. Am I unmuted?
Yeah.
Am I? Okay, sorry. Yes, I'm here in Fresno, California, and I work for a rural community college, and we were displaced pretty quickly once COVID hit, which meant our students weren't allowed into clinical environments. There were a couple that allowed us to go for a few weeks longer. The director, who's also on this webinar, has reached out to numerous organizations asking for, the ability for us to help out in any way that we can. Our students that are in the OB learning area have been totally shut out of their learning for OB. We've asked if we can adopt a pregnant person in the community through different clinics. We've been shut out. It's become very frustrating because we are very willing to try and go the extra mile. And the only organization here in our area that has accepted any assistance from our students is Bitwise. And we've been able to partner with them, but it's basically working with elders, which is great because our students also needed that. But it's been pretty frustrating. It's exhausting, and our students are kind of at the point where they wonder, how can they be so shut out from organizations? How can organizations not see a vision of utilizing students? Cathy, our director, has made the comment, students are essential. She has been working with a group here in our area. We have an academic service partnership, and they come to the table and say, nope, can't do it. If we don't get students again, we're okay. It's very, like I say, it's very frustrating. We're at the point right now where we're looking if there's facilities not far from, like in the Central Coast area or anywhere else that would be willing to let our students come in and get their learning experience because, of regulations with the Board of Nursing. So that's why I say I disagree. We want to try and reach out, especially with us being in a rural area. There's a lot of clinics that are run through different run through facilities, and they've said no. So I think we're at the point right now where we're just really frustrated with the narrow-mindedness of our partners and lack of response.
Thank you for sharing that. Yeah, I definitely. Oh no, that's okay. No, and that's great. We definitely, we all need to hear both sides and to help each other. How can you help break down those barriers? And so that is frustrating. And so I'm wondering what kind of course, without like naming any names, but what kind of organizations are they? Are they, like I know you mentioned not being able to be in clinics, but are they like food pantries, housing organizations, just trying to help brainstorm? And if anyone else on the line has any, have encountered similar barriers, would love to hear how you've been able to help deploy some volunteer workforce with your partners.
And I'll have Cathy probably answering on some of these, but a lot of ours are corporate healthcare organizations. So a lot of that is driven by their corporate, offices. So, that's kind of where we're at. And I know I'll let Cathy answer some more on that because she can help with it as well.
Great, thank you. So Cathy, if you can, if you're able to come off mute, we'd love for you to contribute and share some more information on what's going on in Fresno. And again, just a reminder to everyone, like definitely please continue to chat in how you've been seeing collaboration work in your community or not work in your community, which is just as important. I don't know if Cathy, Cathy, we have not.
Can you hear me?
Yes, now we can hear you.
Oh, okay, okay, weird. I don't know, it wasn't letting me click on there.
It's okay, technology.
Yeah, sorry about that. Yeah, like what Cindy was referring to, our nursing program, we just actually revised the entire curriculum through some funding through the Kaiser Foundation, supported by the Robert Wood Foundation. So we're doing a culture of health curriculum that's rolling out in the fall. So for us, a lot of this moving into the community and all of these social determinants of health and all of this is really right down our alley. So this isn't a tough transition for us, to be honest, in terms of mindset and where we want to go in getting our students into the community. I think when COVID happened, all of our facilities that used to be, and we've kind of prided ourselves on the ability to work so well together, kind of went into these silos because I think they're all, we're in a fee-for-service driven medical environment and we now have nobody in the hospital. They're not making any money. Everybody's on panic mode. So we're really on the low priority in terms of futuristic plans and reentry plans. And because I don't think medical students in medical programs were not listed on essential individuals, we weren't part of the plan for many facilities. I think where my frustration included with that was trying to reach out to various agencies within our counties saying, we've been displaced, these are some things the students can do to assist you. I would assume that you're making calls and we can assist with that. We weren't looking to walk into people's homes. We totally understand. Telenursing is another option, but our area, I think a lot of the glaring things that kind of came up is they aren't prepared for that. They don't even know how that would work. So for them, it was easier for some of these agencies who help seniors and likewise to kind of just shut down. So I was really surprised that in a time when your vulnerable populations need the most support possible, they're not available. So you're finding a lot of private and other kinds of just people in the community pulling together to do things. So there's a lot of that happening, and we can always jump in on food distribution and things of that nature. But any type of really meaningful kind of connection with a population and clients, either through phone calls or any other way, we're really struggling with that because I think everybody's just trying to manage their own environment, I guess. So we joined this today because this was really going to be helpful for us in looking at our curriculum and moving forward. we've been watching the videos from your, that comes out of the health leads and all of that. We don't have your organization locally in our valley, and that is something I think we have to maybe look at for ourselves. We should start some type of a resource center that is student run, things of that nature. These are some of the things that we kind of think about for the future because of where our college is located. It's very rural, and we have a lot of, access to care issues where we are. But, these are just the challenges we're facing. I think things will start to open up, but I think we've been highly disappointed and underestimated really the innovation that we think is should be in our area, and it's just not there right now. So.
Yeah, thank you so much for sharing that. That is definitely something. Oh, I'm having a lot of feedback. I don't know if anyone can just mute themselves. Thank you. So, yeah, thank you for sharing that. It is really frustrating and disappointing for sure. And I definitely agree with you. I think a lot of organizations right now are in that panic mode. And something that we've seen, and I know Stacey and I have talked about this as well, of facilities starting to work in that silo, and in a time where we really need to collaborate and how can we help each other. It's hard not to just immediately go into that silo, and especially like when you haven't been thinking about how do you prepare to like bring in an additional workforce to help you, and how do you train additional people. I think that panic mode of, oh, we don't have time to that may be contributing, and it's hard, especially when, like you said, you have students who do have that capability to help reach out and assist people in this time of crisis. And so, thank you for sharing that. If anyone on the line has any suggestions on how to get over these barriers or help, create any of those solutions, like please definitely feel free to chat in. I think that would be really appreciative. But thank you, Cathy and Cynthia. I really appreciate, Cynthia, sorry. I really appreciate you doing that. And so also we have a question in from Allison. Is anyone on the line aware of other student fields like social work that are valuable but excluded from the essential individuals listing? I'm not sure if anyone on the line can help answer that. Oh, is someone coming off of mute? No. Okay. So we have, so if anyone, again, I'll just read Allison's question for those who may not have heard, but are you aware of other student fields like social work that are valuable but excluded from essential individuals listing? I don't know if any of my colleagues on the line. I am not aware. I know that a lot of people have made adaptations and have substituted student fields out and have been using either like community health workers or have redeployed nurses to help with that during the time, but I don't know if anyone else has anything to add in about that. And again, please feel free to chat in, come off of mute. I don't know if there's any of my HealthLeads colleagues who have any more insight into Allison's question or into Cathy or Cynthia's discussion. But if not, we can move to an open discussion where we want to just take the last few minutes to open it up to anyone else on the line. If there's anything else that has been a barrier for you around resource navigation, if there's anything that has really worked well, that has been solutions oriented, would love to hear from you. If not, I'm wondering, Daniel and Stacey, if there's any other lessons or insights that you guys have seen in Contra Costa that others might be able to apply in their own practices. Well, I think we've got some people coming off mute. Go ahead.
I was coming off mute. I think Therese was going to ask me something.
Oh, yeah. No, Stacey, I'm curious because, you're also in California. So, are you having the same issue with student volunteers not be included on that essential individuals list, and like how are you guys navigating that in Contra Costa County?
Well, I think what happened for us is that we made the decision to remove our students from the clinic when we had all of the information about COVID, because we had concerns about their safety, and then there was a recommendation by the clinic to remove any volunteers that were in the clinic, and so they weren't considered essential. And we made the decision to set up their work remotely. And as a result, there were issues and challenges with them having access to Epic, where they can make documentation about their work with patients, and the primary care physicians can access that information. So there were challenges in that way. But otherwise, we were able to continue working with patients that were already assigned to them, and they were continuing to make referrals to our desk, but we weren't able to access that information in that Epic software. And so that presented challenges. But as far as our relationships with the workforces that we had been working with and continue to work with, they continue to communicate with us regularly, and we were able to talk with them about what it was that they were doing as a result of COVID and any changes that they were making in their workflows. And that helped us to ask them and have conversations with them about how it is that we could support them and come up with creative ideas about collaboration. And that was really helpful. And I don't know if Daniel has some other thoughts that he might like to share.
No, that was really helpful. Thank you, Stacy. I think one of the solutions we're thinking right now around that Epic access for us is we're trying to set up a VPN for our students to see if there's some way, for myself to access that from home, being that Epic is only tied directly to West County Health Center. So that is also another potential solution that we're working on in terms of getting access to Epic.
Thank you for providing that insight. And I just want to acknowledge, I know we only have a few minutes left. We have another chat in from Selena from Crisis Santa Rosa. We run an undergraduate internship who are mainly majors of public health and community health. They were taken out of our facilities in the middle of their internship. Therefore, to compensate, we created projects for them, such as investigating what resources are available and their new processes due to COVID. And so, again, I know we only have a few minutes, but Selena, you can chat this in or feel free to come off of mute. Are you then, I'm assuming then you're sharing all of those resources out. Is that as a good example of collaboration? How have your students found that, trying to keep everything updated? How has that been? And feel free to chat that in or come off of mute. But yeah, I think that, I think Stacy, when you mentioned how, trying to come up with some specific solutions, especially in this time when people might feel overwhelmed, to kind of have that space to really think proactively about it. I think that's a good idea as well. And so I am aware we do only have a few more minutes left, and so Selena, feel free to chat in any more information that might be helpful to others about your program. And if not, we have two more questions, two very quick questions left. Again, I really want to invite everyone to come back. If you're not on the screen, if you have WebEx and you're just listening, we have one more poll left. Ola, if you want to go. Again, this is, the poll is going to pop up on the right-hand corner. It is, during COVID-19, my organization is looking at more ways to leverage screening and navigation data. And so this is a yes or no answer, especially during this time when we're seeing unprecedented numbers of and an increase in resource needs right now. We're just wondering if your organization is collecting, not only just connecting that data, but leveraging that in different ways to help respond in this crisis. And so again, if please come back to the screen if you're not there already. The poll is in the bottom right-hand corner, and we've got about 20 seconds left to answer that poll. And then we will see what everyone says. Okay, so the last few seconds, and then we will see our results. Oh, Selena has also chatted in. So while we get those poll results, Selena has added in that this has allowed navigators to focus more on screening and has been more efficient for our team. Our group of interns are talking and emailing the main person on contact for the organization and are sharing their new findings via an Excel sheet. And that is something that we've heard a lot of, just having either like a Google Doc, Excel sheet, a Google sheet, anything to be able to quickly and efficiently share that information amongst each other is super helpful. And so polling, we had 78% are looking at more ways to leverage screening and navigation data, and I love hearing that. And so that leads me to our next slide of our next Health Leads Network Forum, where we're going to discuss how folks are both viewing this internally within your organizations, broader within your communities, and even statewide, how any of that data might be helping make some changes during this wild COVID crisis we all are living in. And so please join us. Our next one is May 15th from 12 to 1. We will be talking all about data. And so we will send out more information on how to register for this in a follow-up email. And so we have one last poll left. So please, before you leave, just on a scale of 1 to 10, how likely are you to recommend this webinar to a colleague? 10 is extremely likely, 1 is not likely at all. So please take the time to respond to that. That is, again, in the bottom right-hand side. If you have any questions, please feel free to email us at network@healthleadsusa.org. You can visit our website at healthleadsusa.org/network. And also on our Health Leads website, you can find a resource database of COVID resources that might be helpful for your communities right now. And so I just want to thank you all again for participating today. Really appreciated the conversation we were all able to have. And like Ola mentioned in the beginning, we'll be sharing out the recording and sharing out some the slides and some best practices on this. So thank you again for participating, and have a great day.